Association is asking for signatures on its new petition for PeaceHealth to restore its contract with Eugene Emergency Physicians. This comes after the hospital announced last week it would instead opt to work with an out-of-state group, Apollo MD, to staff its emergency rooms. PeaceHealth says it's not renewing its contract with Eugene Emergency Physicians, which staffs the hospital's emergency department with physicians and physicians' assistants. That decision would mean 41 staff at Riverbend and Cottage Grove would be let go at the end of their current contracts. In an interview with PeaceHealth last week, the hospital said it hoped those physicians would stay on by applying to the new group.
Apollo MD is our partner who's going to be joining PeaceHealth to provide services at all 3 campuses in Lane County. And we would welcome them to work with our excellent physicians who are already in the community. I hope that a lot of these doctors wind up staying, but that is ultimately between them as physicians and Apollo MD as the group.
However, ONA says the physicians aren't interested in signing contracts with Apollo MD, with all 41 signing a pledge not to return. ONA says PeaceHealth now faces a challenge to find skilled ER providers after ending its decades-long relationship with Eugene Emergency Physicians.
There's a shortage of healthcare providers nationally, of doctors, of nurses, and so finding replacements, even Apollo MD would struggle. You're getting folks with a revolving door who would be here for a few months and then gone, and that's even if they could get those folks. It's not easy to get. It doesn't make financial sense. It certainly doesn't make sense for patients.
Erin Huffam, who left PeaceHealth in December of last year after 10 years as an emergency physician, says the physicians in the ER have had to overcome many challenges of their own over the last 2 years since the closure of the University District Hospital.
There wasn't really a plan in place to handle that surge of patients to another facility. It's been routine the last couple of years to see patients in hallways and closets, and have patients that need to go into the hospital and upstairs sometimes wait for days in the emergency department. It's made it difficult with wait times. It's made it difficult to care for patients.
It's those emergency physicians, he says, who try to implement ways to improve service times in the ER because they too live in the community and care about the quality of care residents receive. Huffam says he's now speaking up for his colleagues who can't due to non-disparagement agreements.
These providers don't want to work for an out-of-state corporation. They don't want to reapply for their job, and they don't want to work for a company that's known for cutting and squeezing in an already incredibly difficult environment.
We reached out to PeaceHealth today to follow up on the latest developments on this staffing shakeup. In a statement to our newsroom today, PeaceHealth doubled down on its previous stance, saying, quote, "While contract discussions are between individual physicians and Apollo MD, we sincerely hope these physicians choose to remain in the community and continue to work with us."